Good morning, everyone, and welcome to the Grantees Position for Success seminar series as hosted by the Georgia Rural Health Innovation Center here at Mercer University School of Medicine. This month, we're pleased to have for our monthly seminar series, Dr. Cheryl Gaddis as our guest speaker for today, and she is speaking on engaging communities with enthusiastic communication. Dr. Gaddis is an associate professor of practice and chair of the Department of Public Health in the College of Health Professions here at Mercer University. She serves as the director of the Master of Public Health program. She received her Doctor of Public Health degree in Community Health Behavior and Education from Georgia Southern University, a Master of Public Health degree from Mercer University School of Medicine, and a Bachelor of Science degree in Biology from Spelman College. She is also a certified health education specialist, and she joined Mercer in 2003 as the community health systems developer for the Mercer Center for Community Engagement and instructor in the School of Medicine. She has over 20 years of experience as a public health practitioner and has held various academic roles, including Director of Community Resources, Assistant Preceptorship Director, Associate Director of Programs and Community Engagements, and Assistant MPH Program Director. She worked as a public health education specialist contractor with the Centers for Disease Control and Prevention for 3 years. Prior to joining Mercer, she served with the North Central Health District 5-2 as the Health Promotions Coordinator. Dr. Gaddis has taught within the MPH program at Mercer University for more than 13 years in the public health areas of health promotion and education, minority health and health disparities, and social determinants of health. She has also taught in the community medicine program at the Mercer University School of Medicine for 10 years. Her research interests include health disparities in underserved populations, children's health, health promotion, and minority and rural health disparities. She has conducted and published works in community-based interventions and research on physical activity engagement among elementary school children, food access and security issues, as well as childhood asthma school practices. Dr. Gaddis is an active member of the American Public Health Association, Georgia Public Health Association, and the Georgia Society of Public Health Educators. She is engaged in service with various community organizations on the local and state levels as a board member, public health consultant, and grant, abstract, and journal reviewer. Dr. Gaddis obviously is a very well-versed individual and professional in the field of public health and has an array of experience working with various community members. Ladies and gentlemen, if you would please welcome Dr. Gaddis at this time.
Good morning, everyone. And first, I'd like to thank Dr. Williams for inviting me to speak with you today. I hope that the information I provide is going to be very helpful to you as you go about your work in the community. So let's go ahead and get started. So as Dr. Williams mentioned, I'll be speaking with you about the community engagement process. And I want you to think about these questions as we get started. How do we meet the needs of individuals and families and local communities while still nurturing a sense of belonging, a capacity for resilience, and the ability to thrive? And how do we communicate with the communities that we do not regularly interact with? Because a lot of times, the communities who we want to engage are not communities where we live, work, or even play. And so today we'll answer these questions by focusing on methods for engaging community leaders and members to develop partnerships to support the mission and purpose of your organization, to bridge the connections that you'll need to yield the strategic collaborations that will benefit not only you and your organization, but also the local community, rural Georgia citizens, and even beyond those particular communities. And also to deliver efficient communication, considerate follow-ups, and valuable post-project reports. Now, as representatives of community organizations, I'm certain that many of you have some form of experience in engaging communities. And if you've done any form of community engagement, you recognize how complex, challenging, and sometimes very labor intensive it can be, but it's very rewarding too. Some leaders may not have previously developed the required skill set that's needed for this process. So today I will address community engagement by discussing these particular agenda topics. So we'll talk about getting to know the community first. And then once you get to know the community, how do you engage them in partnerships? And then how do you make that partnership succeed? How do you maintain community collaboration and communication? And then we'll end with some examples of community engagement. Now, depending on your organization, you might also refer to community engagement using other terms, and it just really depends on what the focus of your organization really, and what it is that you're doing. So you may have heard the term community outreach, community collaboration, community-based participatory research. We use that a lot in academia. Customer service. If you're dealing with patients, you may refer to it as patient care. And there may be some other terms that's listed in the word cloud here that you may be more familiar with. But any form of work that you do that involves direct interaction with and participation of the community is considered community engagement. So I want to make note of this first because I recognize that each person represented here today may use different terms to define how they work with the community. However, all of these terms relate to community engagement. Now, before we start our discussion, I wanted you to view this video, which provides a very basic review of community engagement. And I don't remember if I clicked on for the sound. So let me stop sharing and reshare just to be sure, because I want you to be able to, most of it is your reading, so you would only hear music anyway, but I just want to be sure. Okay, so as the video describes, community engagement is defined as a process that involves various groups of people who are associated by the same interest, situations, or locations to bring about changes in policies, programs, and practices that they're involved in. And community engagement can take place in different forms, as collaborators can include groups, It can include agencies, institutions, and also individuals. And it's something that can evolve over time from addressing maybe just one common issue to eventually addressing a range of factors that affect health within a community. And so community engagement is really important for several reasons. First, it can improve health promotion and health research by allowing for a common agenda to be set between the organizations and the community involved. And so one of the things that you want to make sure of is that you're able to do that. It's not just about focusing on what you want the agenda to be or what even just what the community wants it to be, but by being able to develop a common set agenda. A common agenda allows for focus on a specific project, and it can remove the limit on opportunities for funding that requires community engagement. So oftentimes there's funding that you can apply for, but you can only apply for it if you have demonstrated community engagement. And so this process is very important for that. Of course, you want to make sure that you're engaging with the community for the benefit of the community as well. And that funding can also benefit the community. Community engagement in the design and delivery of health programs allows for the input of the community's knowledge of local circumstances, resources, and other helpful information as well, ensuring that the program is one of interest and importance to the community and not just to those who are maybe just interested in working with the community. And the knowledge and skills of the public involved can enhance the project, and their contributions can also be recognized. And so these efforts really foster goodwill, and they help lay the groundwork for subsequent collaborations that may take place. Before starting the community engagement process, it's important to first get to know the community that you desire to work with or that you're providing services to. And so that requires gathering all of the information that you can, because even if it doesn't seem useful initially, it may be helpful later. So as the cartoon says, get all the information you can. We'll think of a use for it later. Many times you may gather information and you have no idea what you might use it for, but later on you'll go back and you'll see that you have that information and you're thankful that you actually gathered it. That's happened to me quite a few times when working with communities. So you want to be clear about the purpose or goals of the engagement effort. What is it that you want to achieve? And are you able to clearly articulate that to your potential partners? This allows them to understand why their participation is needed and is worthwhile. And perhaps your community involvement may be a condition of grant funding, so community engagement is required for the organization to receive funding, or engagement leaders may include community organizing and mobilization as part of their mission or profession. But most importantly, community engagement can specify health-related concerns. It can identify areas that maybe need action and allows the community to become involved in the planning, designing, implementing, and even the evaluation of appropriate programs. And so the leaders of the community engagement should be very clear about their needs from the community. Is it just to seek data information and feedback for designing a program? Or is there true interest in partnering and sharing control with the community? This needs to be clearly articulated with the community and getting to know them. Becoming knowledgeable about the community helps to determine if they are appropriate to approach for engagement. So learning about their mission, their vision, their values, those kinds of things. Are they the appropriate community for you to actually approach? So this involves learning as much about the community as possible. You can use both qualitative and quantitative techniques. So qualitative, where you may interview key leaders in that community, or you can review the quantitative data through needs assessments that may have already been developed for that particular community. But all of these sources allow you to really understand the interaction of both the physical, the social, as well as cultural environments of the community and how they interact with individual behaviors to affect health outcomes. These sources also assist in identifying different maybe assets and resources that are already available in the community. It also helps you to identify what resources and assets may still be needed. Additionally, you would need to understand how the community perceives the benefits and costs of participating. So this is very important. Will their participation facilitate decision-making and consensus building, or will their thoughts and ideas just be overlooked? Consider if the community is really ready to adopt new strategies to address whatever issues are being identified. So you don't want to go into a community that's really not at a stage where they're ready to take on new ideas and new strategies that you may be proposing, or that even comes out of a partnership with them. Because if you identify the issues, you determine strategies, but they're not ready to implement them, then your work will actually stop right there. And how would attempts to engage the community around new issues affect pre-existing efforts of maybe already developed coalitions and partnerships? So many communities already have these pre-established coalitions and partnerships that you'll identify when you go there. And you don't want to try to engage the community around an idea or issues that may contradict the work that's already being done there. So you want to really get to know the organizations and partners that are already there, what they're doing, and how that can relate to what it is that you want to do with the community. There are several questions that you should answer in researching communities that you want to work with, or specific organizations or individuals who you want to collaborate with to address different issues. And so how does your potential partner's mission and goal align with yours? Well, you and the organizations that you want to engage should have the same or similar missions and goals, because this will ensure that you'll be able to work together to achieve similar outcomes for the community. You wouldn't want to partner with someone who is working on something completely different from what it is that you want to engage the community around. What resources do you want the community to contribute to help you achieve your goals? And what resources can you and your organization contribute to the community to help them achieve their goals? So what resources do you need the community to bring to the table? And how do those resources fill a void with what you may be missing? But in turn, what resources are you able to bring to the table? And how can you share those resources with the community to be able to meet your goals? It's not good to go into the community just expecting that they're able to provide everything that you think that you need to establish your goal, but also to make sure that you're able to bring something to the table that's going to be helpful for them as well. And I'll talk about that, or actually give an example of that at the end. So what can you do to be sure that both sides understand why the goal is important to each other? How can you work together to reach those goals? And this understanding, along with the other information that you gain by getting to know the community, allows both sides to really trust each other and to move towards developing the partnership, which is the next phase in the community engagement process. So everyone holds a piece of the puzzle to form a partnership, and getting to know the community helps you to identify how each piece of the puzzle connects to actually form that partnership. It's often beneficial to connect with a range of community representatives. So there are formal representatives, such as organizations and the coalitions that I mentioned previously, but there are also informal representatives, such as individual community members, and local key informants. So to connect with these potential partners, you must actually go to the community. It's not something you really can't get to know a community in detail unless you actually go there. And going to the community also provides additional information about them and what they're doing, and factors that can either facilitate or inhibit their participation in the engagement process. Going to the community is also a step to building trust, demonstrating that you feel welcome in a community and are actually willing to maybe step outside of your comfort zone and your own organization, shows that you truly have an interest in the community, and it will allow them to open up and trust you. The community coalitions usually have a range of organizations and partnerships that are already established that you can tap into. And so this is one of the best ways to get involved with multiple sectors of the community that have the same interest and mission as your organization in order to earn their trust. Implementers of engagement efforts can work together directly with key stakeholders and community members. And the coalitions can actually be helpful in identifying who those stakeholders and key informants are in the community, rather than you trying to or attempting to identify them yourself. A lot of times the key informants are people who are embedded within the neighborhoods and are not easily accessible. But once you get to know other people in the community, maybe through the coalitions, their organizations that are involved, and different individual members from them, then they can in turn introduce you to those individual key informants that are in the community that can provide additional information. So it's helpful to be able to refer to notable organizations in the community, to have them as a reference when contacting individual members, especially for the first time, because it can be difficult making a cold call to someone that you don't know and they don't know you. But being able to have someone else connect you to those people makes them more likely to open up to you, and that they'll feel comfortable interacting and speaking with you, so you can determine appropriateness of the partnership and give them the same confirmation from their end as well. Now, once a successful rapport and relationship is established, then these meetings can build on ongoing and meaningful partnerships. You should never make the assumption that just because the community consents to a meeting with you, that is going to result in them agreeing to a partnership or a collaboration. That's a common misconception that we often go into communities with. Well, if they accepted this meeting with me, then I know that they're going to be a partner with me. And you can never make that assumption. The communities must be able to assist in defining the problems and solutions that are being addressed within their community, instead of being told what the problems and solutions are. And them feeling that they basically have the authority and knowledge, or you going into a community and feeling that you have the authority and knowledge to tell them what the issues are and how to solve them, excuse me, is one of the biggest mistakes that those attempting to engage in communities make. And so it can quickly turn the community away and isolate them and any further attempts at collaboration too. So the acceptance of collaboration, particularly on the part of the community, is more likely when the community encounters as few barriers as possible, and that they believe that the participation process is going to be open and supportive of their thoughts and ideas as well. After establishing your relationship with the communities and getting their buy-in to partnership or collaboration, then you can actually organize the partnership. Now, all partners must be actively respected from the start. That includes respect for you and respect for the members of the organizations from the community that you've engaged. And one way of doing that is by meeting with key community leaders and groups in their own and familiar surroundings, especially for the initial partnership meetings. People tend to feel more comfortable on their own grounds. And so during the first meeting, the partners should also be introduced, and you should determine the roles that are being made. So deciding on a leader is important, because leadership should not be assumed by any one entity, meaning that you shouldn't assume that you're going to be the leader going in, and the community shouldn't assume that they're going to be the leader. But the person or organization, as well as the community, should decide upon that mutually. Designate a specific leader. And as a group, other decisions should be made about what resources are already available or needed, and the time frame of the actions that will be completed by the partnership are also things that you should determine. So making sure that you establish who's going to be the leader, and you can have co-leaders. So you could have someone from the community as well as someone from your organization who are leading, and deciding, what work needs to be done first of all, and then who's going to lead the work, who's going to do what components of the work, and also identifying what resources you have, what resources do you still need, and what is the time frame. Established community collaboration requires long-term commitment from both you and the community to maintain it. So once you develop those partnerships, you still have to work to maintain that collaboration and communication, even after the work is done. And so you can do this by providing regular updates on the status of your work, and also receiving updates on the status of your partner's work from their individual efforts as well. So this maintains trust between the entities that are involved in the collaboration. And even if you're simply letting them know that you have no updates, then it's still important to make sure that you're communicating with them. You can identify opportunities for frequent communication with the community outside of regularly scheduled meetings. So the frequent communication with stakeholders and partners is important. While you still want to maintain a presence in the community, a physical presence in the community, you can also communicate with them by phone, email, virtual meetings. I mean, there's a wealth of technology resources that you can use to maintain that open communication with the partners that you've established in whichever community that you've worked with. So you should also seek opportunities to work with community members to enhance local understanding of your focus issue. So you can join or help organize community health fairs, maybe different workshops, educational opportunities, and other community events that support your goal, and maybe even those that only support the goals of the community. So you don't have to go to the community and participate just around those things that are of interest to you. If you go and you're participating in other things that they're doing, that enhances their trust in you and the collaboration that you've established with them. And it allows them to maybe identify other opportunities for engagement with you as well. And then finally, to continue to monitor the community's perception of your work. So are you doing what you said that you would do when you first came to that community? Are you going to continue working with them, even though your goal may have been achieved? And maybe are there funding opportunities that you can pursue as a partnership that go beyond what your initial goal was in working with the community? So just be able to identify what other ways you may work together other than what your initial goal was. Now, these methods of communication, once your collaboration is established and your goals have been met, is critical to future collaboration opportunities. Practicing these different communication skills shows your enthusiasm as well as your appreciation for working with the community. And that means that if they're able to see that coming from you, then they're more likely to work with you in the future on other endeavors. Now, as I mentioned at the beginning of the presentation, community engagement can be challenging. However, there are many benefits to going through this process, both for you as well as for the community that you're working with. So you're able to create higher quality solutions, which means that they won't be basic solutions that are limited to just the community that you're working with. They may be more advanced solutions that you can take to other communities as well. It allows for better conflict management and resolutions. And so being able to work with communities and within communities is very important. It's very important that you're able to have those conflict management skills, because there are times when, even though you set out to make sure that everyone is on the same agenda, that someone may go askew. And so being able to manage those when those conflicts actually occur is going to be very important, so that you can resolve them and still move on with the work that you've determined to do. Community engagement also strengthens a sense of community. And that can be done in multiple ways. So when you talk about strengthening the sense of community, that can be for the community itself. It can be strengthening a sense of you belonging within their community. It can strengthen the sense of them belonging in yours as well. And then creating communities that take a greater sense of responsibility for what is happening in their area. So being involved in community engagement is something that really brings in community members and gets them involved. And when they get involved, then they do take more responsibility for what's going on. Instead of, just going about their daily lives within their community, they're more likely to actually stop and take a look around their community to see what's going on, to see what's needed in their community, and to see maybe even how other communities are affecting theirs. So it's important for community members to be involved and engaged in the process of what it is that you're doing, because it will help them have that responsibility. And they can also give you ideas moving forward on different things that they may have identified that need to be addressed. And now, just as there are benefits, the challenges that I referred to are very present, and they have to be acknowledged in order to overcome them. So distance can pose a barrier to open and accurate communication and engagement. So you have to be open to traveling to the community, as I stated earlier, and not just expecting them to come to where you're located. A lot of times, the communities that you may be working with, especially in rural communities, may be further out. And so it may be harder for you to leave your office or wherever you are to go to them, just as it may be difficult for them to travel to you. You have to take into consideration that many times community members don't necessarily have funding or budget to be reimbursed for travel. And so asking them to drive to you, especially if you're far out, can be a problem. So making sure that that distance issue is addressed, and that there's equal opportunity, I guess, for travel between you and the community that you're engaging. The backgrounds and languages of those seeking community engagement are often different of the actual community members that you're working with. And this is something that I've experienced many times in my work in public health and working with communities. There are some communities that I go to, and my title, having doctor in front of my name, or, going in as an African-American female, with a, I guess, maybe a higher ranking title, can be intimidating to some people. But then to others, they look at me and they say, that they're very proud of my accomplishments. And so they welcome me into their communities, basically as one of their own. And so you just really have to figure out where your community is in terms of how they're going to react to you. And it's important to meet the community where they are and earn their respect. So for instance, when I'm going into communities, many times I am introduced as Dr. Gaddis, but I will quickly tell people, call me Cheryl. For those who insist on putting the doctor in front of my name, I'll say, well, call me Dr. Cheryl or call me Dr. G. You don't have to say Dr. Gaddis, because I want to earn their respect and I want them to understand that I respect them as well. And making yourself, putting you on the same level as your community and them putting themselves on your level is very important, and being able to overcome those challenges of backgrounds and maybe even languages that may occur. And then conflicts and misunderstandings can result when the expectations of those seeking community engagement differ from the community. And this is something that I alluded to earlier. So you must really respect the opinions and expectations of the community. Even if you don't agree with them, that's fine. But you have to make sure that you have, that you're offering of what you have to offer and what your expectations are of them. You have to make that known up front, or the community will quickly let you know if they can or want to meet your expectations. And if they need your help in meeting those expectations, they'll also let you know that as well. But from both ends, making sure that the community lets you know what their expectations are of you is important as well. A few years ago, I was in working with a group in Crawford County, looking at food access and security. And the first thing that they told me in the meeting that we had is that they had someone else from Mercer who'd been in their community and had told them, different things that they were going to do. But they never fulfilled their obligations. And so this was something that I had to come behind. And they already had basically made the assumption that I was going to do the same thing. And I quickly, let them know in order to try to alleviate their misunderstandings that was not my role. And I made it clear what my role was in me being there. What the person who had been there before had not done is that he had not actually told them specifically what it was that he was being brought in to do. So the organization had actually brought him in. It wasn't that, he was seeking community engagement, but the organization had actually brought him in to do something very specific. But in the interim, he'd also told them other things that he was able to do that he did not fulfill. And so I was very upfront and clear to let them know that those promises that were previously made were not made by me. And it was not my intention to fulfill those promises in me being there, but that I was there to work with them specifically on food access and security. And so once we got past that, we were able to work together easily, open up with each other, make sure that we were always, we had everything out on the table as far as what our agenda was and how we wanted to achieve that. So making sure that, you're able to address any misunderstandings and conflicts that come up is going to be very important with your community engagement as well. So I have 3 links here for resources that I'll give to Dr. Williams so that you can access them. But much of the information that I'm providing today is elaborated on within these resources. The Agency for Toxic Substances and Disease Registry Community Engagement Playbook is the first link. And it includes a fillable planning tool that you can use to help you identify community engagement goals, partners and stakeholders, key actions for information gathering and sharing, and then community engagement activities, materials. And I think there's also a timeline in here as well. I think that this is a very useful resource for you, and that it will allow you to be able to participate in the engagement process. I will tell you that this particular resource has a focus on community-based participatory research. And so if you're not really engaging in the research process, then these other two resources are going to be better for you. The second one is the Collective Impact Forum Community Engagement Toolkit. And that includes tools for planning community engagement with a focus on equity. And so in my opinion, any work that we're doing in the community needs to have an equitable approach, because we want to make sure that what we're doing is benefiting everyone. And so this particular tool does have a focus on health equity and allows you to apply the health equity lens in your work. Now, this last resource is focuses on working with rural organizations or rural communities. The University of North Dakota Center for Rural Health Community Engagement Toolkit is a really good resource. It provides a step-by-step guide for community engagement, and it has several documents and examples that can be used to guide you through the process. And so I encourage you to take a look at that one first when you receive these links, and then take a look at the others just to see if there's other information or tools within them that can be helpful to you as you go about the community engagement process. So I want to close the presentation by providing some examples of my own successful community engagement. And one of the first roles that I held in public health was as a chronic disease prevention coordinator at the North Central Health District in Macon. And in that role, I worked with 13 counties, including Bibb County, and those that are most geographically close to it. And any of you who are from Macon or live in Macon know that most of the counties that are closest to Bibb County are rural, with the exception, of course, of Houston and a couple of others. And so one of my roles was to establish a coalition of organizations that had a focus on chronic diseases. And of course, in order to establish the coalition, I had to travel to all 13 of these counties to engage the community. And there were many trips back and forth to the counties where I conducted windshield surveys, where I would drive through the communities, and with the windshield survey, you're basically just driving through, you're looking around, you're making note of things that you see that could possibly affect the community. So for instance, you may drive through and see that within our more rural communities, there may not be any grocery stores, or there may only be one grocery store. You may see that there may mostly be fast food locations there instead of maybe healthier options for food. And so those are things, of course, that are going to in turn affect the community's health. And so I would drive through, do windshield surveys. I would attend planned meetings with community leaders. I would attend church meetings. And I met with many individual community members. And in between the meetings, I would still follow up with phone calls and emails. And while I was, going there to determine what the issues were in the communities, and also to identify what organizations I could invite to be a part of this coalition, I was also able to establish partnerships outside of that coalition as well for other work that was being done in public health. And so given that many of the counties were rural, there were not many organizations that were already working in the area that were directly from the community. But I was able to connect and establish partnerships with over 20 organizations representing each of the 13 counties to form the coalition that we needed to form. And the coalitions, their members hosted health fairs, they provided educational and medical services to prevent or treat chronic diseases. And I was able to help them meet their goals with resources and funding from the Georgia Department of Public Health through the district office. While I was still able to meet my goals and meeting the objectives that were outlined for chronic disease from the state office. So the different initiatives that they were involved in, their numbers, their reports, and things of that nature are things that I was also able to use in my reporting to the Georgia Department of Public Health to let them know what's going on in the community to address chronic diseases. So I'll just talk about one other one. I was involved with community engagement with Pentecostal Temple and Ingram Pie Elementary in Macon as well, to develop a health and wellness program and then an after school program with the elementary school. But I think to this day, I still say one of my greatest community engagement and most successful opportunities was with Out Enough Incorporated and Greater Little Rock Baptist Church, which are also in Macon. So when I came to Mercer to work, my role was to work with the surrounding community and engaging them in health promotion efforts. And one pastor that I met, his name was Reverend Larry Eason, and he was the pastor of Greater Little Rock Baptist Church. And we were talking, and he was telling me about his ideas for establishing a daycare. And I, in turn, of course, expressed to him my interest in developing a health and wellness program. And so we were able to merge our agendas in order to achieve both. We started with the daycare center because that's what the community wanted. And it's important to focus on what they want first. And so we were able to get a grant for funding to purchase the chairs, the tables, computers, all the resources that they needed for the daycare. And then they supplied the staff to run the daycare. And within a year or so, we were able to actually build a building on the site of the church campus so that the daycare was moved there and they were able to actually expand the daycare. And we also established a health and wellness program so that on Wednesdays, before Bible study, they would offer healthy meal options for people to come in and have their dinner, then have Bible study, and afterwards they would engage in a physical activity class. And so both of us were able to achieve our agendas. We were able to earn the trust of each other. I earned their trust and them allowing me to work with them on these initiatives. And they earned my trust as well, because I actually enrolled my oldest daughter in their daycare when they started. So we were able to engage not only within the work that we were doing, but also on a personal level as well. And to this day, I can still go to Macon and I can call Reverend Eason is no longer with us, he's deceased, but I can call the other staff who were there. And they always remember me and are always ready to talk about different things that are going on. So these are the kind of relationships that you want to maintain with the organizations that you're working with. And I'm going to stop here because we have about 10 minutes left. And I see some things in the chat. So I'm going to first, let me stop sharing my screen. And let's see. All right. So I wanted to, first of all, invite for maybe the first 5 minutes, if there are any of you who have experience with the community engagement process, if you wanted to share what your experience has been. And then we'll take questions that I can hopefully answer if you have them.
Hi, Dr. Gaddis. I'm Rachel Shorey. Thank you so much for your information. It was a great presentation. I work for the Heard County Community Partnership in Franklin, Georgia, and we kind of are unique in that that's our job. Collaboration is our job. We are the Family Connection affiliate for Heard County, and so that monthly we bring, partners to the table to talk about, what they're doing and how we can partner and vice versa. And so I would just encourage everyone on the call that to find your Family Connection organization in your county. That's a great place to start. If you have an idea or a need for your own organization, there's probably somebody around that table that's also involved in that work. So if you're not involved with your Family Connection, I'd just put that plug in for you.
Mm-hmm. Thank you, Rachel. That is very important. I think every community that I've ever worked with outside of here in the Atlanta area, the first thing I did, as you just said, was to identify the Family Connections organization. And when I was living in Houston County, I was very active with their Family Connections, a wealth of resources, lots of organizations involved around different initiatives. And so I mentioned earlier about working with coalitions to identify other organizations that you may want to work with. So thank you. That's a good way to be able to do that. All right, if there's no one else who wanted to share their experience, I would like to open it up. If there are any questions, then I will be happy to answer. Well, hopefully no questions means that I covered all of the information that you needed to hear.
I think there's a question in the chat box. Dr. Gavin, how do you suggest we monitor community perception?
Yes. So thank you. One way for monitoring your community perception is basically to ask. Sometimes what we do is we may do surveys, which is kind of like an evaluation of the work that you've done. And it allows the community to be open without, feeling like they'll be penalized if they say something that may not necessarily be positive. And so those different surveys will allow them to let you know, what their perception is of how you interacted with them, the work that you've done, whether or not you accomplished what you set out to do. And then even beyond that, so are you still working with that community? Are you still participating in different activities? Are you still reaching out to them? And then asking them, what is it that you may still need from me? Are there ways that I think I'm communicating, but you feel that there are other ways that are better? Getting their ideas and input about how you're interacting with them is how you can also monitor that perception.
Dr. Gaddis, I
Yes.
had something to add. I'm with Harris County Family Connections, and I agree with everything Rachel says. You need to join us, everybody. But prior to that, I manage a homeless program over 7 rural counties. Mm-hmm. One of the things I found was that we need to bring everybody to the table. A lot of times we will bring organizations to the table. But I found that just doing some grassroots organization with common people, just people I see out in the community. I remember a lady who was a retired teacher, but because she had been in that community for years, she knew every single person. Mm-hmm. I used to go visit her home and she could tell me everybody's story. There was another lady who was on the Historical Society and she knew everything about the buildings and who owned them. And so when you bring a variety of people to the table, you get a whole lot more community engagement. And another thing I realized was that I had to make sure that they were in the decision-making process, because when I leave, they need to continue. The whole succession thing needs to go on. So if it's all about me, when I leave, everything falls. And I want to make sure that when I leave, somebody's there to carry on, to hold the baton on and carry on.
Right.
Yeah.
Right. Thank you. Thank you for those comments. You definitely want to make sure that, and I think I mentioned earlier about making sure that the community that you're wanting to engage is ready to actually make change and address the issues that you've set out to address. You don't want to go into a community and you come up, you work together to identify issues, you come up with these great solutions, but they're not ready to implement them. Or they're ready to implement them, but only because you're there and you're helping them do it. And then once you leave, which is one reason why you should not leave, but you should maintain that collaboration with them, then everything falls apart. So again, maintaining those open lines of communication with the communities that you've worked with is very important, because there may be opportunities that you come across later that can be beneficial to them. And so maintaining that communication with them allows you to let them know about those opportunities. You may be able to collaborate with them again. And that can be helpful to both ends as well.
One last question, I'm sorry. Will we be able to get a copy of the PowerPoint from this presentation?
Sure. Yes, I will send that to Dr. Williams.
All right, thank you so much.
You're welcome. All right, Dr. Williams, I'll turn it back over to you.
All right, Dr. Gaddis, thank you so very much. Wow, a phenomenal presentation, great content, great advice, great recommendations. And I have plenty of notes myself, so I trust that our community members that have been on this session today also have plenty of notes. And certainly, if you don't mind, I'll share your contact information with them in the event that they have more questions in the near future.
Okay. And you can also provide my contact information. If there's anything, I mean, I didn't go into detail into a lot of these areas because of the time, but if there's anything that you feel like I can elaborate on and help you with, please feel free to reach out to me.
Absolutely. Thank you so very much again.
You're welcome.
Also, before we close, we just want to remind everyone that this Grantees Position for Success Grant Preparation Seminar Series will come to a close next month. We have our final seminar on August 9th that will highlight activity assessment amidst implementation. You can register there at the website if you have not done so already. And also you can revisit and rewatch the video recordings from each of the seminars from the previous months. So again, Dr. Gaddis, thank you so very much for your time and contribution today. Thanks to each of you all for attending, and we look forward to seeing you next month. You all take care.